Thank you, everyone, for joining the Candida and Fungal Overgrowth, Rebalancing Using the Effective Biological Approach. My name is Heather Schofield, and I'm a homeopath and also the Medical Educational Director with Biomed and Terra Medica. I'm really pleased to be able to talk about Candida and fungal overgrowth in the respect of addressing it from the biological medicine approach, as this approach is very effective and also is very much about what we do here. And looking at the terrain, looking at microorganisms, looking at symbiosis within the body, and getting things rebalanced and regulated. So this is really about the end result of how to address Candida and fungal overgrowth in a very effective way. Before we start talking about how to address it all, let's talk about what it is. So Candida, essentially what is it? Candida is a form of a yeast form of fungus that naturally occurs as part of the normal flora within the mouth, gastrointestinal tract, vaginal mucous tissue, and also the skin. When we're using the term Candida, there's many different forms or species of Candida. Tonight, specifically, we're going to be talking about Candida albicans. However, there is, as I said, many other species of Candida. Candida albicans, however, specifically can become a very virulent form depending on the environment and depending on how the body's immune system is functioning. And this is the form that causes Candida infections and yeast infections and systemic Candida type conditions. And so this is the one that we're looking to get back into balance in the body when it's gone out of balance. So Candida plays a very symbiotic role within the body, and it's naturally kept under wraps with the immune system. And normally in our normal flora and fauna, what we end up is having approximately 1 Candida or yeast microorganism to 1 million healthy bacteria. So it's a very, very small component of our floral landscape within the intestinal system in the gut. However, it still is there, and it still does pose and have a very important role within the body. Number one, it aids in digestion, and a big part of that digestion is digesting fermented and more putrefaction of foods that go within the system. It helps aid in nutrient absorption. And it also helps bind heavy metals, namely mercury, in the mouth and in the gut. I'll talk about that more in just a moment. And then finally, it aids in decomposition of the body after death. And this is a big part of really what it's doing within the body. Interestingly enough, there's a veterinarian in Ontario, and he works as a biological medicine doctor with animals. And he often would speak about decomposition in the body. And so this is when the body starts to become acidic, the milieu and the terrain go out of balance, and the environment within our body starts to turn some of these decomposers on, and Candida being one of them. Candida, they're not necessarily intelligent. So they don't know, oh, this person is only 45, and so it's not time to start decomposing their body yet. But this is because of the milieu and the different triggers that it uses, starts to act in this kind of way, so can start to lead to some chronic degenerative type conditions within the body. And it's not specifically Candida that does this, it's also other types of fungal microorganisms within the body as well. So if the body's pH and conditions and the milieu and the terrain start to go into a more acidic type way, then these decomposers can start to turn on. And this is really a big part of what their job is the body after death to get it decomposed. And so one of the big things we're going to be talking about tonight with the milieu and the terrain and acid-base balance is having those all in a very balanced way, so therefore these decomposers don't get turned on, and then the body remains in health. So Candida and heavy metals. There are 2 well-known and renowned medical doctors who have a huge amount of knowledge regarding this, and they're also biological medicine practitioners. And you may know of both of these doctors as I mentioned them. So Dr. Dietrich Klinghardt, he's a world-renowned mercury detox expert, and he talks about Candida yeast overgrowth as one of the ways that the body tries to keep mercury and other heavy metals from damaging the body's tissues. And so therefore the yeast serves a purpose for absorbing and sequestering heavy metals from the tissues. And so there's a rise in Candida overgrowth or fungal overgrowth, or the body is proliferating or the yeast is proliferating to protect the rest of the body from the heavy metals. You'll often hear, at least from a very biological medicine perspective, that yeast or Candida and heavy metals go hand in hand. And part of the reason is the Candida is trying to bind these heavy metals and essentially in a way is protecting the body. And so sometimes then when people are doing a Candida diet, the Candida die-off is happening, it's also really important to keep the heavy metal component in mind, because then this heavy metal may end up being freed up rather than being excreted from the body, and more support or die-off reaction may be shown. So it's a really important factor when dealing with Candida to remember about this connection and have tools to be able to address it. The other doctor, Dr. Thomas Rau at the Paracelsus Clinic in Switzerland, he talks about Candida and Candida valences, or this is, in a pleomorphic perspective, the ability to upregulate and downregulate from less pathogenic to more pathogenic type forms. And so when the milieu or the terrain is severely blocked, and specifically due to heavy metal burdens, then you're going to see Candida valences or high valent, or these upregulated into more pathogenic forms start to occur. Candida symptoms, in many ways, is very similar to mercury intoxication or mercury symptoms, heavy metal symptoms. Chronic dental foci and amalgams are associated with Candida. There's a strong association. And Candida and Candida albicans being one of them, but also Candida parsilosis are found or can be cultured off of root canal extractions from the pulp and the roots. And so it's not so much the belief that the Candida was initially there when the root canal was performed, but more, though, that it migrated there with the ability to start binding onto these heavy metals. So the association is that the Candida ended up manifesting in those tissues because of the amalgams that could be available. There's also stool analysis that shows positive results with Candida and patients with amalgams. And then finally, diverticulitis is hotbed for Candida and heavy metals. So the next time you have a patient with diverticulitis or a diverticulitis flare-up, don't forget about Candida and heavy metals and those as being a potential for why those diverticuli are flaring up. So Candida overgrowth, how does it occur? Candida and fungal populations are naturally kept under control through a healthy intestinal flora and the immune system. And from an understanding about Candida or Candida overgrowth and understanding pleomorphic processes, understanding microbial symbiotic relationships in the body, this is the key. And this is really the key with Candida and dealing with it. And dealing with it so you have an effective reduce of the population and effective reducing the symptoms. The immune system in the body and the intestinal flora, that is where things need to be targeted. The Candida, of course, needs to be targeted too, but it's really about getting the terrain and the environment in a healthy place so then it can also then host healthy, normal, very low Candida populations within the body. And so this overgrowth occurs when other things start to change in the body, when the milieu and the terrain are affected in the body, and then the intestinal flora starts to change. And if the diversity of the intestinal flora and also the numbers in the population decrease, then it leaves room for more of these pathogenic type or opportunistic type microorganisms to start to proliferate. The immune system, and I'm going to talk about the immune system in a moment, and why it's also a really huge key to this whole Candida overgrowth. So types of things that can change the flora or alter the flora in the gut are diet. Diet is a huge part. Of course, we're eating in multiple times a day, and North American diet is full of refined carbohydrates and sugars, and full of a lot of high amounts of protein as well. And these are types of things that can change the pH balance in the milieu terrain. Alcohol consumption, high stress lifestyle, antibiotic and antifungal medication use. And this is one of the key components of changing or altering the healthy flora, especially if after antibiotic use the flora is not replenished with probiotics or with fermented foods, then it just has opportunity for opportunistic microorganisms to start to increase. Oral contraceptives and steroid use. This is another big aspect, and it changes the hormonal balance in the body. And again, so that changes the terrain in the body as well. And then finally, the immune system or decreased immune defenses. So I want to talk a little bit then about the immune system, specifically with Candida. So the flora, microflora, healthy intestinal bacteria, that's a big part of it, but the immune system, as I said, is the other big key here. So Candida albicans has 3 different morphologies. There's the budding yeast form, the pseudo-hyphae form, and then the hyphae form. And it's the budding yeast form and the hyphae form that are the 2 that can become virulent or pathogenic. And they also play a key component with the immune system. So with the immune system then, the cellular immune defense is the central importance in preventing Candida. It's triggered through certain antigenic surfaces, structures on the Candida cells, and then the T lymphocyte population gets stimulated, and it helps by the excretion of lymphokines. So the point is that a well-functioning immune defense is able to damage both the yeast form and the mycelial or the hyphae form of Candida through phagocytosis. However, once Candida starts to get settled in, or candidiasis, or this Candida overgrowth, the effectiveness of these macrophages of the immune system becomes restricted. And part of it is, and if you see this hyphae form, it starts to look like a web, or this intricate pattern where these growths are happening with the Candida, and then you get different Candida individuals starting to grow together. And once that growth starts to happen, then the phagocytosis is not able to effectively get into these mycelial or hyphae surfaces as well. And so it's basically just rooting itself really well within the body. And these adaptive mechanisms of Candida to the immune defenses in the human are very subtle and very extensive. And it almost appears to be intelligent, this intelligent binding and counter-binding concept of Candida with all the receptors allows these especially virulent species of Candida to potentially thrive within the body. So this is why the immune system within the body, a well-functioning immune system, is really important in order to keep the Candida fungal overgrowth down. But then it's also a big component of the terrain and the milieu and the flora and the fauna. So I know I keep repeating this, but these are really important aspects of understanding about Candida and fungal overgrowth. Okay, just wanted to double check here. So if you do have questions, then again, I just want to remind you the Q&A section, you can type them in there, or you can also type them into the chat section. And then that way, as you type them in, I can see them come up. This is audio only, so therefore, any questions that you do have, you're not able to actually ask them to me. They'll have to be typed in. Okay. So I wanted to make a note on antifungal medication use with Candida overgrowth. And again, this is coming from a biological medicine perspective, so antifungal or antimycotic use. The idea with it, and I know that it's a very well established route of dealing with Candida. The one thing that's really important to remember, though, is in many cases using an antifungal or an antimycotic could push the Candida into a cell wall deficient form. We're going to be talking about that a little bit later, but the whole idea when it goes into a cell wall deficient form, the immune system in the body is no longer able to target the bacteria or the fungus, and therefore it goes kind of as a stealth pathogen. This book which I believe you can get off of Amazon.com, by Lyda Matman, talks about cell wall deficient forms and calls them stealth pathogens. So it's kind of like the Candida. If there's been an antifungal or antimycotic medication, pharmaceutical medication treatment, but not just, let me also mention that it also can be through herbs as well. Then it can throw the Candida into these cell wall deficient forms, and then the body's not able to see them at all, and then they can go and wreak all kinds of havoc. We do have a remedy called Pleosan Cand that I'm going to be talking about later that can actually assist in these types of situations. The other thing with these antifungal or antimycotics, as I mentioned before, that the adaptive mechanisms of Candida albicans is very, very subtle, very expensive, and almost an intellectual kind of way. So what happens is it just drives the Candida deeper into the tissues of the body, and then this leads to symptoms and more systemic type issues. So Candida overgrowth, the symptoms, and these are the types of symptoms that you may be seeing within patients. Gas and bloating, that's often a very common one. Intestinal-like disturbances, diarrheas, or constipation. Leaky gut, and leaky gut, there is a very strong association between Candida and leaky gut, and leaky gut allows the Candida to get into the bloodstream through the intestinal walls into the bloodstream and then cause systemic issues. Sugar cravings and fruit intolerance, allergies or itchy ears, autonomic nervous system disturbances, autoimmune disorders including things like Hashimoto's, ulcerative colitis, lupus, rheumatoid arthritis, chronic yeast or vaginal infections, urinary tract infections, or rectal or vaginal itching. That's also a very big and very common symptom. Bladder infections, fatigue, brain fog, and depression. The fatigue and brain fog are also very common type symptoms. Nail fungus, including toenail fungus and fingernail fungus. Skin issues, athlete's foot, jock itch or groin itch, fibromyalgia, and chronic fatigue. And the list could continue on as well. Types of symptoms. So here's some images that one could see. The coating, the white coating on the tongue, that's a big indicator of Candida. So with your patients, one thing it's important to remember during physical examination is to examine all parts of the body, including the tongue, and asking them to stick their tongue out. I would imagine this is probably, in this image, a little bit more serious or than what you would typically see. However, white coating on the tongue indicates Candida, systemic Candida overgrowth. And when we're talking about systemic Candida overgrowth, what that means is that the Candida has gone deep kind of into the tissues. And now, so when you see things like toenail fungus, what you're seeing is the nail starts to discolor, the nail starts to change, it becomes in texture, and so more brittle, more crumbling, yellow, and this is a typical like picture of a nail with nail fungus. But it's not so much, the Candida isn't sitting on the toenail specifically. I mean, it's kind of within those tissues as well, but it's already deep within the body, and it's manifesting on the nail. And so one of the things why it's important then to do a systemic approach from a biological medicine perspective is because you're getting the terrain and everything changed, and then you can also topically work at clearing the nail fungus as well. So it's a few different approach when you're dealing with the nails, but it's still using the same concepts from a biological medicine perspective. I did have a question pop up from Dr. Girolamo about fruit intolerance. And so essentially what that is when it's related to Candida is a funny, funny is not the right word. It's a sensation of when you're eating fruit, not tolerating it very well. So for example, itchy kind of things, or so the tongue could be itchy, or there could be kind of interesting sensations on the tongue. It's almost like having a reaction to the fruit. And so that would be with the sugar cravings, the sugar would not be advisable from that perspective. If somebody has a fruit intolerance, to be eating fruit as the cellulose source, which I'll be talking about later, So I hope that's answered your question. It's essentially when they're eating the fruit, they don't feel well from it, whether it's an allergic-like reaction that they're having or also just sensations. I know that I've had patients talk about a buzzing of their tongue or buzzing of their lips when they've eaten fruit, and that could be in relation to Candida overgrowth or an indication of it. Okay, so some other things, we talked about the itching, rashes, constipation or diarrhea, bloating, fatigue is a really big one as well. So Candida overgrowth, different types of tests that you can perform to determine Candida overgrowth. And so the first and the foremost, beyond anything, is of course patient history and symptoms. So if they're talking about different types of things, like let's say they do talk about fatigue and gas and bloating, and maybe for a female there's urinary tract infections, these are types of things to have in the back of your mind from a biological medicine perspective. Is there a fungal overgrowth component with this patient? You can also download off of the internet a Candida questionnaire. They're all over the place, so you just Google them and you can come up with one. And a Candida questionnaire, what it ends up doing is it asks lots of different kinds of questions. And questions, for example, let's just see here. Major symptoms, fatigue, and then you would score 3, 6, or 9 points. Feeling of being drained, poor memory, insomnia, muscle aches, impotence, premenstrual tension, attacks of anxiety or crying, vaginal burning, itching, discharge, diarrhea, and so you score it. And then there's also this other group of symptoms, including burning upon urination, sore throat, nasal itching, hair, foot, or body odor not relieved by washing, bad breath, drowsiness, and the list goes on. And so the idea is you go through and you score these, or have your patients score them, and then you add them up. And whatever the score is would then determine whether there is a potential that there's Candida overgrowth or not. So for example, in this questionnaire that I just kind of mentioned, the total score for the 3 sections, if it's below 60 for women or below 40 for men, then less likely to have a Candida problem. However, it's higher than those values, then there's a good chance that there is. So that's one way to help determine about Candida overgrowth. Now, some other testing that you can do, blood testing, IgG, IgA, IgM, Candida antibodies. The one thing, now I don't practice these specifically with my patients, but these are types of tests you can use. One thing that was said about the blood test is sometimes it may show up negative, but you may get a positive stool or urine test. So with the blood test, it may not be the only thing that you want to be doing. The stool testing, this one is the one that is the most comprehensive and I guess indicates the most. And so with this stool testing then, Candida level, what it will show is Candida levels in the lower intestine and colon. What you need to do is order a comprehensive stool analysis, and what this will do is help determine species and which treatments will be effective. Doctors Data, which is out of the U.S., does a comprehensive stool analysis, and in the comprehensive stool analysis, there's one of the, in parasitology, what it will do is look at the yeast culture, and so look at flora and fauna and dysbiotic flora, looks at yeast levels, and then the other thing that it will do, in addition to talking about Candida, is it has another aspect where they go and yeast susceptibilities for Candida albicans, and in there they end up testing the Candida that's been determined from the stool against different things like berberine, caprylic acid, citrus seed extract, oregano, titanic acid, uva ursi, and it will talk about, it will show which the strain of Candida from that patient that's been cultured out, what has the best ability to be able to address it. So it also looks at nystatin and iatrazole, so it also looks at some antifungals as well. And so that is a really nice way. It helps you then determine kind of what's going on, what species, the amount, and then some ideas of things that could be potentially useful for your patient as well. Mind you, they're not necessarily from the biological medicine approach. However, they still are useful. It's useful information to have. There's also the urine organics dysbiosis test, and so it's detecting waste products from Candida overgrowth, and it tends to determine Candida in the upper gut or small intestines. And then finally, I ended up seeing this quite a bit. I don't know anything about it or its accuracy. However, there's a spit test that you can do. And what you're supposed to do first thing in the morning before you've had anything touch your lips, you're supposed to spit into a glass of water and check it every 15 minutes for up to an hour. And so then there's 3 things you can be looking for. If this saliva is sitting on the top of the water but it's grown down these legs, or if it's sitting halfway in the middle of the water and it's cloudy or has these floating specks, or if it sinks to the bottom, then it can indicate Candida. If the saliva still remains clear and floating on the top, then is no indication of Candida overgrowth. So that's something that potentially could also be done with patients as an at-home test or an in-office test. Okay. And so there's a couple questions here that are related to this, so I just wanted to answer them here. So the best algorithm for testing, number one, of course, I think patient history and symptomology would be the best one. And then I would combine that in with a Candida questionnaire, and I would do the comprehensive stool analysis or stool testing if you are able to do that. And that would be a really good indicator kind of all around of what may be going on as far as Candida or fungal overgrowth. I know in a lot of practices that maybe are not able to do laboratory testing, that then the questionnaire could definitely give you a good idea of what's going on. My only concern with the questionnaire is that a lot of the types of questions that are showing up in here can also be related to many other types of things. And so with a questionnaire, it would give you a really good idea of what's going on, but one of the things is, would it lead you towards the idea of Candida when maybe it was something else as well? So there needs to be some differentials for that. And as far as the urine dysbiosis test, as I mentioned before, in practice I haven't used that one, so I'm sorry I can't give more information about it. I have used the comprehensive stool analysis testing through Doctor's Data, and so that is what, at this point, what I would recommend, because it's something that's easy to do. And it's relatively cost-effective for patients, and you get a lot of information, and it's not specifically just about Candida, but it also can give you a lot of information about bacterial overgrowth and just kind of general health and well-being of a patient as well. Okay, so now the biological approach to the elimination of Candida and fungal overgrowth. Sorry, I guess just before I get here, let me just answer this one last question. Initially, you would want to do the testing to get your baseline. And after treatment, I guess it would depend on the patient and how much money they're able to do with lab testing. So if you're finding after treatment that symptomology and the patient is feeling really well, I wouldn't necessarily go through a complete comprehensive stool analysis again unless there's a lot of other things that you are wanting to examine. And so the before testing for sure is really important, but if you're able to do the after testing as well, then it is great for patients because then they can see the before and after and know that the treatment that you're using works. I did get a comment in here that one of our practitioners online has used the urine organics test from lab interpretations for years, and it's been very helpful and very useful. So the urine organics test from lab interpretation is what I'll do is I'll just post that for everybody so they can see it. And I just popped that into the chat room. So there's a test. So the urine test, as one of our practitioners just mentioned, is very useful. Okay, so then the other thing, just before we continue talking kind of from a biological approach, is when there is Candida overgrowth, the one thing, and this is actually, it's a very good point, Rita, thank you for bringing this up, is that I mentioned before we need to keep mercury in mind because Candida has a tendency to bind onto mercury, and so if there's Candida overgrowth, and one of the things we're doing is addressing the Candida and trying to reduce this overgrowth, we also need to have mercury in the back of our mind as something that's a possibility with that patient. So it would be a good idea also to be doing a mercury or heavy metal detox at the same time or before doing a Candida cleanse. It's also important, if you're able to, do some testing so then you can actually determine whether there is heavy metal that are in excess within the patient as well. And one of the things they say is if you don't address the mercury or you don't address the heavy metals, then the Candida may come back. And so that could account for treatment and working with treatment with patients. And perhaps this isn't why you're able to successfully eliminate the Candida overgrowth. So remembering, again, mercury and Candida go hand in hand, and so often the treatment with heavy metal detoxing specifically for mercury and also for Candida often need to also go hand in hand in order to be able to successfully get your patients so that they can eliminate the Candida overgrowth. So from a biological medicine approach and how to eliminate Candida, healthy gut, balanced intestinal flora are two super important things, and then you add in the aspect of the immune system. And a healthy gut and a balanced intestinal flora will actually lead to a strong immune system as well. So those are essentially kind of the three components when we're looking at Candida and how to address it. So who needs to restore gut health? So this isn't specifically about Candida, but this is just in general about gut health. So starting from birth and as life progresses, many gut damaging factors can include things like the type of delivery at birth. C-sections are a prominent way for babies to be born into this world, and through a C-section, the baby is not inoculated with the microflora through the vaginal canal, and so that's one of a newborn's first introductions to the flora and the fauna, and it's also very important. And so the type of delivery at birth is an important one, and an important one to ask if you can remember to ask that. Whether a baby or an infant has been breastfed, and then the types of foods that they've eaten in the first year of life. Breastfeeding also, again, helps the gut and the immune system mature, but it also helps to inoculate the newborn and then infant with the healthy bacteria as well. Dysbiosis and Candida and yeast. That can be a gut damaging factor, but also a damaged gut can lead to that as well. Chronic infections, over acidity of the body, which can be through stress and diet and polluted environment, essentially, that we live in, unless we're luckily out in the country somewhere. Food allergies, chronic stress, heavy metals and toxins, poor diet, and eating the wrong types of foods, and various medical interventions and medications, including antibiotics. These are all types of things, or if somebody's had these types of things, then restoring gut health would be essential. So in a lot of ways you can see almost everybody, all of our patients could technically fit into this category. And gut health is something that should be an ongoing process for, the rest of our lives and the rest of our patients' lives and our family and friends. So it's good to always be doing things that are positive for gut health. So let's talk about the constituents of the gut. And this will just give an idea then. Again, this is going back to the whole terrain, milieu, biological medicine approach. There's three components: the mucous membranes, the Peyer's patches, and the bacterial lining. And I'm going to talk about each one of those and the importance of it for health. So why is the mucous membrane so important? It represents a protective barrier from foreign substances entering the body. Essentially, our gut, or our digestive system, gastrointestinal tract, it's almost like the reflection of the external world going internally. So when we take things internally through our mouth, we still need to protect the rest of our body from it being absorbed across the mucous membranes. And so this is what this mucous membrane is doing within the body. It's protecting us from the outer world, essentially, in a lot of ways. It's critical for absorbing nutrients. It's important for detoxification. It's involved in acid-base balance. It's a major defense system in the body and secretes immune substances for mucosal immunity. The other thing when we're talking about Candida is as long as we are not having a leaky gut kind of scenario, then the mucous membranes can keep the Candida sequestered into the intestinal system and not allow it to go systemic. And so that's another reason why the mucous membranes, when we're talking specifically about Candida or fungal overgrowth, why it's so important. The Peyer's patches, these are immune cells and has T and B production. 80% of the adult immune system resides in the small intestine, and if overburdened and decreased performance, the human body responds by making more lymph nodes, which leads to adenoid and tonsillar swellings. So in children, or if you have patients that repeated tonsillitis, tonsillar swellings, adenoid, enlarged adenoids, then one thing to keep in mind is about their gut, and is these other glands in the body responding and trying to create more immune response because the gut is being compromised or overburdened. And from a biological medicine perspective, the answer is yes, and so that's why going back and clearing the gut is really important. And then finally, the bacterial flora. So it nourishes and protects the mucous membranes. It offers resistance to growth of bad bacteria and fungi, so specifically Candida, and also systemic yeast. So the bacteria flora is also really important at keeping the yeast and Candida in check. It's also important for digestion of food, helps produce enzymes and vitamins, aids nutrient absorption through the gut wall. It detoxifies the body. These guys, the bacteria flora, soak up all kinds of toxins, including things like arsenic, and so when they're excreted, then these types of toxins are also excreted through the stool. They help to deacidify the body, and the acid-building anaerobic bacteria transport organically bound acids from the body into the stool. They manufacture all kinds of different vitamins and essential fatty acids and amino acids. A decrease in intestinal flora can be correlated to chronic illness, and this is now being seen more and more often. Is kind of the buzz. The gut is still a big kind of buzz in intestinal flora and probiotics, and so there's lots of really good information getting out to the public and to our patients about education regarding this, about how important the intestinal flora is and how important the gut is, and healthy gut equals healthy body. And then finally, stimulation and proper functioning of our immune system. Okay, I just saw that. Do we have another question come in? No, okay. So restoration, regeneration, regulation, these are three components that are really important from a biological medicine perspective when we're talking about the gut. So as I've said and will probably say many times throughout the rest of this presentation, that keeping Candida and fungal overgrowth in check is really about the intestinal flora and a strong immune system. And how do we keep the intestinal flora? How do we keep the gut? How do we keep our immune system functioning in a really healthy, balanced, regulated way, while through restoration, regeneration, regulation of the gut. And so these components include things like gut flora, and probiotics are a big component of that, isopathics, fermented foods. So whether our patients or ourselves were taking a probiotic or we're eating a fermented food like sauerkraut, for example, or kimchi that contains the lactobacilli, then these are really good ways to be able to continuously populate the intestinal tract with these beneficial and healthy flora. And also another component is eating a diet that supports the flora. So of course, if we're drinking a lot of coffee or drinking a lot of pop and cola, eating huge amounts of animal proteins, eating trans fats and French fries and potato chips and all the things that are really not healthy, then this is also not going to be supporting a healthy flora. We need to make sure that in our regular diets and also in our patients' diets that we're eating foods that support them so then they can continue to flourish and keep the body healthy. The mucous membrane lining is also really important, so how to promote that is through the diet. Again, I'm going to be talking about food and diet, and so that will include how to support a healthy mucous membrane in the gut, essential fatty acids, and oils. So for example, olive oil is really important, but flaxseed oil could also be included in that, and coconut oil is also a big component of it. And then in some cases, some supplements like glutamine is really good for the mucous membrane lining. Boosting the immune system and supporting the Peyer's patch is another big aspect of that. Regeneration, removing food allergens to stop further gut damage. We'll talk about food allergens in a little bit with the diet component. And so it's important to get those out of the diet so therefore the gut can be healed. And then supporting regeneration of cells and weak digestive or diseased organs, again, through things like healthy oils and diet and gut flora and such. And then finally, regulation, so allowing the body to continue to regulate. And self-regulation, so the body needs to be detoxified, and so through this component, alkaline food is a big component of that, and continuing to eat that. Deacidifying, so acid-base balance, and we'll talk about acid-base balance remedies in a little bit. And then finally, enhancing hormonal and cellular metabolism. Okay, so just before I go on, I had a question come up here about how coffee can damage the gut flora. It's not so much specifically about coffee that is so much the damager. It's more that coffee is an acidifier. And so by drinking one coffee a day and eating plenty of vegetables, it probably cancels each other out. However, drinking multiple cups of coffee every day over a lifetime, but this can also be black tea as well, it's an acidifying food. And so therefore, as the terrain and the milieu change and the pH balance changes more towards acidity, this can damage the gut flora because the environment for the gut flora is not in its beneficial pH and terrain kind of balance. So that's the reason that coffee over long term could be a contributor to the gut flora and demise of the rich garden that it could be. The other thing that I want to talk about, and I'll talk about it, there's some really lovely visuals and examples that I want to talk about regarding the flora in the body and things like swampy, murky kind of places, just to, for those of you who are very visual, to give you an idea of changing the terrain, how that can really support a healthy population of flora and fauna in the body. Okay, here's a picture of Dr. Rao, and he is very passionate about regulation, self-regulation. This is a quote for him: "We treat humans, not symptoms or diseases. We support the regulatory forces in the human, which brings healing from the inside." So this is going, again, back to regulation and supporting regulation, regeneration, and all of those types of things, going back to the gut and the flora and the intestinal system, and really letting that self-regulate, so meaning then the flora can regulate within themselves to keep things like candida and other types of stuff back in balance and at bay. So eating for restoration and regeneration. To do this, it removes potential allergens and acidifying foods from what you eat on a daily basis, and it allows a healing of the intestinal system, mucosal lining, bacterial flora, and Peyer's patches. the basics for restoration and regeneration. And when I'm talking about this, so there's not specifically, from a biological medicine perspective, there's not specifically a Candida diet. Because when you're talking about biological medicine and biological terrain, you're really talking about one type of way of eating, so this restoration, regeneration idea, and that's going to be suitable for most kinds of symptoms and conditions that exist out there. It's more about supporting the body and getting things back re-regulated and in a healthy pH balance. And then that is going to help everything else from a microbial, isopathic, bacterial, fungal component all come back into regulation as well. And so this is kind of eating for life, eating for health, and these principles are things that should be introduced into all of our patients' repertoire of how to eat, and then these are just basic things to be following for a lifetime, essentially. So the basics for eating when we're eating for restoration and regeneration is we're supporting naturally a building up of the intestinal flora, eliminating things like cow dairy, gluten, and other food sensitivities. If there's no sensitivity to cow dairy or to gluten, then they don't necessarily need to be removed, but it's just the idea of any food sensitivities or allergies to be having those out of the diet. Reducing large amounts of protein. Protein should be coming more from plant sources and some animal sources, but just not huge amounts of it. Increasing raw fruits and vegetables. Supporting the liver function, bile flow, and bowels, and also acid-base balance to support the milieu. So the diet in general, these are just, again, more principles in general. So it's low in protein, 40 to 60 grams a day. This is actually 60 grams a day is how much protein, and we're talking about both animal and plant, but animal protein specifically. Protein, this is how much can be processed in the body on a cellular level in a 24-hour period. So if somebody's eating more than 60 grams of protein in a day, the body's not able to do it, and so this excess creates excess acidity and then contributes to a demise in the acid-base balance and the terrain in the milieu, and also the regulation of the body. And with protein, plant-sourced proteins, in a lot of ways, especially with patients in chronic degenerative type conditions, the plant-source proteins are just better and easier to digest and less acidity overall. The diet generally is alkaline in nature, and a healthy body in many of the tissues is naturally slightly alkaline. This does not mean the stomach is naturally slightly alkaline because all the tissues in the body have their ideal pH ranges, but overall there's a slight alkalinity to the body. Raw foods, and so foods that are high in cellulose support healthy and beneficial flora, and then specifically with Candida, and helps prevent Candida converting to the more pathogenic forms. And it also helps move the Candida out of the body as well. Food that's free of allergens, particularly cow dairy products, they can cause congestion, inflammation, impairment of the immune system, and disrupts regulation in the body. And then high in omega-3 essential fatty acids enhances cell metabolism, cellular membranes, transmission of neural signals, oxygenation of the tissues, healthy flora. And healthy flora will also manufacture more omega-3 and 3s and 6s in the gut as well. So the importance of the diet, so when we're talking about this in general, but also this is very related to Candida, following it for 6 to 3 months for natural regeneration of the cycles of the bodies, the cellular components of the body. So different organs have different times that it takes for a regeneration cycle. And so if you follow eating like this for 3 months, this is going to be able to support that. Also is going to help allow the intestinal tract to heal, repair and regenerate, and also support a good turnover of the gut flora. It excludes primary antigens to allow the mucosa of the small intestine to repair and regenerate. This diet excludes refined carbohydrates and sugars, and refined carbohydrates and sugars can be contributing to Candida overgrowth. Includes digestive enzymes and coconut oil. So again, this is specifically to Candida. Coconut oil, or the caprylic acid, which naturally exists within coconut oil, essentially pokes holes in Candida And so it's one of the ones that can be used. The digestive enzymes can also help to break down the cell walls of the Candida. The diet also helps restore the immune system and help with leaky gut syndrome, and then finally naturally detoxifies and deacidifies. So I just wanted to make one quick comment about Candida overgrowth, the starvation diet or Candida diet, which is about carbohydrate-free Candida diet. From a biological medicine perspective, it's not really necessary. If we're working on the gut and we're working on the flora and then we're working on the immune system and we're getting everything back in control, then doing these starved kind of diets aren't really the beneficial way to support healthy microorganisms in the body. And so, of course, it is recommended that refined sugars and refined carbohydrates like white breads and white rice are not included, but it doesn't mean a carbohydrate-free diet. Candida is regarded as a sugar consumer, and if you starve Candida or fungus, what happens is you'll push it into upward development into its more pathological forms from a pleomorphic perspective, and then this also drives it deeper into the tissues where it can feed off glucose from the blood vessels, so then you're going to get more symptoms more systemically within the body. And carbohydrates from raw foods with cellulose are ideal because, one, it does feed the Candida, but it keeps the Candida in the gut. It also feeds the beneficial flora, which helps to support, them coming back and keeping the Candida at bay. It keeps, as I said, keeps Candida in the gut or the intestines, and then it also accelerates passage through the gut to be eliminated, and so it helping to remove the Candida or eliminate the Candida from the body, and then also is going to assist in elimination of heavy metals as well. So I want to talk now about the pleosanum, some of the pleosanum fungal remedies and Candida remedies specifically. And so this is bringing all the information we've talked about, talking about Candida and what it is and what symptoms are, and then talking about biological medicine. So let's start to tie all of that together with what types of things from a biological medicine approach can be used to successfully eliminate Candida overgrowth in the body. So the pleosanum remedies, if they're remedies you're not familiar with, then they are very easy to use. They're non-toxic, there's no side effects, they're effective in children and also safe for any age group. So whether it's an infant all the way to elderly, they work in all of those perspectives. From the pleomorphic perspective, the internal environment is responsible for the establishment of fungal, viral, bacterial, and degenerative physiology. When I talk about the internal environment, again, this is within the body, so the terrain and the milieu. Therefore, most infections and fungal conditions can be resolved by modifying the milieu. And so what that means then is, and this is where I want to give the example. So imagine you've got a lovely clean pond, and clean, and when I say clean, I don't necessarily mean it's free of microorganisms, but you've got a pond, you've got fish, very healthy fish in there, there's frogs, there's lily pads, there's beautiful lilies, there's bulrushes, there's all kinds of red-winged blackbirds and insects, and this pond is really thriving. There is a diverse ecosystem that's happening there. This is a pond that, if it was a very hot summer day, you'd want to jump in and maybe have a nice, cool swim and really enjoy it, and not worry that if you end up getting some water in your mouth that you're going to get really sick. And then let's say across the way, there's another pond, but this pond is more like a swamp. So it's full of algae, and it's gooey, and it stinks, and there's gas bubbles popping out of it. This is where there's lots of mosquito larvae and mosquitoes, and maybe there's some crocodiles in there, or maybe not. And the vegetation is more swampy-like kind of vegetation. This is definitely not a pond that you want to take a nice cool dip in on a hot summer day. And if by chance you did, you definitely don't want to swallow it. So you've got these two different environments. One's representing a very healthy, thriving environment, and one's representing a very sluggish, stagnant, non-healthy type environment. what has happened in the more swamp environment is that it's still catering to things that thrive in that environment, but when you're thinking about it from the body's perspective, it's almost like that's when the body becomes out of balance. That's when it's not being regulated. That's when the acid base is more acidic and all the pH ranges within the tissues are not in their ideal ranges. And so therefore, things like Candida, but also things like other types of microorganisms that are pH sensitive, they're going to upregulate and adapt to this new, more congested kind of picture. And so the whole point is, if you want to be supporting healthy, non-pathogenic physiological forms in the body, you need to have the optimum environment for them to grow. And so this is very much about this milieu idea. And so therefore, most infections and fungal conditions can be resolved by modifying the milieu, with the idea that if our bodies and our patients' bodies have become acidic over time and moving more towards a chronic degenerative condition, the idea of reversing that and changing the milieu and terrain and getting it into that more healthy, beautiful, clean pond environment, the fungal microorganisms that are pathogenic and that are virulent and that are causing symptoms and infections and all of these things, they can't thrive in this healthy, imbalanced environment and regulated environment. So by changing and modifying the milieu, then the symbiotic microorganisms and the opportunistic and all of the ones in the body are also going to follow along and be in a more healthy, regulated way. And so that, in a lot of ways, is kind of the basis of milieu, but it's also it's a real foundational component when talking about biological medicine as well. The pleosanum remedies, one of the beauties is that they're supplying the body with these healthy physiological forms, and then by addressing pH imbalance, then you're going to be supporting that and helping to downregulate any of these pathogenic forms in the body as well. And so that's what I want to talk about next. But before I get there, there's a few questions that I wanted to answer. And the first question, it's going back to diet about fruit. And so fruit and Candida. And so one of the things with fruit, again, if you're talking from the biological medicine perspective, I wouldn't recommend when you're dealing with Candida and trying to have it downregulated and eliminate it, that a patient is eating a really heavy fruit diet. However, cellulose is important. And so things like apples would be something that would be okay because there is a lot of cellulose. It's not so much being concerned about the sugars in that perspective, but I wouldn't be necessarily eating huge amounts of fruit or really high sweet fruits, but more using fruits that are really high in fiber to be able to support from that cellulose perspective. And it would definitely be better to have a higher vegetable diet opposed to fruit diet. Okay, so then I have another question here about mercury in the teeth. I'll answer that question when we get to the end of the presentation. And it's got some good biological dentistry information as well, which is very good. Okay. So with the Candida remedies then, from pleosanum, there's 3 different ones. There's a 4th one, but I'm not going to talk about that 4th one tonight because it's a combination remedy, so it addresses a few different things. So the 3 I want to focus on are pleoalb, pleopef, and then pleocand. Pleocand, I don't have any more information in the notes other than just right here. And so just keep in mind, pleocand can be used when a patient has had a history of Candida and candidiasis and Candida overload, and they've taken antifungals or antimycotics or potentially gone through many Candida diets with a lot of herbs that are antifungal, and they're still getting symptoms as if they have Candida. It's possible that the Candida, if it's gone into the cell wall deficient form, that the pleosan remedy will actually help flag that and then help reduce and eliminate the Candida from that perspective. So that remedy is a really nice one for clearing a history of Candida. And I would potentially add it in if there is a patient that has had a long history of Candida. The other two remedies, pleoalb and pleopef, let's talk a little bit more about those. So specifically pleoalb and pleopef, they're both Candida species, Candida albicans and Candida parsilosis. They represent Candida cyclogenes, and they introduce, so these remedies specifically introduce regulatory forms of Candida species back into the body to help reduce and downregulate the highly developed forms into less pathogenic ones, therefore reducing fungal infections and the related inflammatory processes. Candida constitution. So when we're talking about constitutions, constitutions are described in lots of different types of literature and different modalities in different ways, but generally a constitution is an individual's, it determines the type of typical disease pattern is expressed and how disease develops within the body. So from a standard perspective, there's the mucor constitution, the aspergillus constitution, the penicillium constitution, and then the Candida constitution. It's of the four constitutions, the one that is the least prevalent within the population, but it still does exist. And so the Candida constitution then is a tendency towards fungal and mycotic conditions and dysbiosis. And typical conditions include local or systemic fungal infections, especially of the skin or mucous membranes, candidiasis, and digestive issues, including gas and bloating. There's in the Pleosanum component, this is a summary of the 4 different constitutions and then the types of remedies that fall into those constitutions. So since we're talking about Candida, the Candida remedies, milieu remedy is Alcala. There is not an organic acid that is from Pleosanum. There's not one that was created specifically for Candida. I believe it does secrete a specific acid, but off the top of my head, I just don't quite remember what it is. But yeah, as far as an organic acid remedy for Candida, we don't have one available. The isopathic remedies is pleoalb or albicans, pleopef or pefrikeel, or pleox or exmacheel. Exmacheel is a combination of pef, alb, and then another remedy called fort as well. That one we don't currently have available, so that's why we're just going to talk about alb and pef today. The bacterial remedy is a remedy called leptusin or pleoleptu. And then finally, the Sanicale remedies are Sanicale cand and also Sanicale trick. Trick is another skin fungal microorganism, and it is called Trichophyton varicosum. And so this tends to be like tinea, ringworm, infections of the skin and the hair follicles and that type of thing, hair loss. It's all very involved with kind of the hair and the skin on the body. Okay, so pleoalb then. So it's a remedy made from Candida albicans, and it's great for all Candida and fungal conditions. So when we talk about pleoalb and pleopef, there's some differentiators. So Candida albicans or pleoalb, it is tended to be used for chronic and systemic fungal conditions of the mucous membranes, the skin, the urogenital, and gastrointestinal tracts. So what we tend to see is the typical Candida-like symptoms. So the gas and bloating, the digestive type things, also maybe the tongue with the white coating, yeast infections, vaginal yeast infections, urinary tract infections, nail fungus, whether it's toenail fungus or fingernail fungus, athlete's foot, jock or groin itch. These are all types of things and symptoms of Candida or systemic Candida that pleoalb would be addressing. Again, high levels of Candida can also be associated with high levels of heavy metals, including mercury. So those two things, again, hand in hand, and addressing that is often very important when you've got a systemic case of Candida with a patient. The dosage depends on the product form. So what I have done for you here is created a handy-dandy chart that goes through the different forms for pleoalb. There's drops. So the drops are great to use orally, also in the ear or nasal application. Oral, generally 5 to 10 drops once daily. In an acute situation, can be used more frequently. The ears, 1 to 2 drops per ear. It's advised when you're doing application with the ear with the center remedies that you do both sides, even if there's only symptoms on the one side. And then nasal, to inhale or snort a few drops up each nostril up to several times a day. The suppositories, generally it's suggested to use them once a day, but generally not more than that, and often less than that. Sometimes 3 times a week would be sufficient. Especially if you're dealing with Candida, then 3 times a week would be good. Use before bed. It's good for systemic kind of general infections, and it can be used anally or vaginally. If a female's having vaginal yeast infection, if it's an active one, then again, anally or vaginally, the suppository could be used. Sometimes if there's a lot of discharge, then it's recommended to use it anally because it's going to go systemic anyway. And the other thing just to recommend or to know about using suppositories vaginally, these ones, because they're coconut oil based, the vaginal mucosa doesn't tend to absorb the oil component of it, so therefore there can be some discharge that happens once the suppository has melted. Ointment, this easy topical application, I'm going to talk about it a little bit more in the next slide. It can be applied several times a day to any local or topical skin or nail components. The capsules, for the 4x potency, 1 capsule up to 3 times a day. And then finally the ampules. These are sterile ampules, and they can be used as sips or you can drink them, but in Europe they're also used as injectables. And so in Europe, the European dosage, 1 ampule 1 to 3 times a week, more frequently in acute cases. So with Pleoalb then, it is a great topical remedy when you're using the ointment. So the drops are tending to be used more for the systemic candida, fungal overgrowth, digestive type symptoms, so the gas and the bloating, and any kind of symptoms that are involved, because essentially what you're doing is getting into the gut and helping to downregulate the pathogenic candida. And as we saw in those earlier slides, the hyphae and the yeast buds, how downregulate them all into the physiological 1 candida yeast to 1 million healthy bacteria ratio. The ointment is really great when you're dealing with nail fungus or infections of the skin or vaginal infections. It acts essentially like a natural antifungal. And so if you've got patients that have nail fungus specifically or athlete's foot, what is often recommended is that you still continue using the oral drops because you want to address this systemically. And then locally, what you would do is use the ointment topically on the nail once a day as well, just so that you're also addressing it where it actually is manifesting as an infection. And then it's also recommended with the nails, the feet or the hands, that they're submerged in an alkaline bath with baking soda once a day, because that's going to be changing the terrain as well, and so making it a less hospitable place for pathogenic candida to survive. Okay, so then let me talk about Pleopef. It's a Candida parasilosis species, and so it tends to be more for local candida or fungal conditions of the mucous membranes. So you tend to see more of the skin, of the orifices, so meaning of the orifices, tendency in the mouth, thrush in babies, cradle cap or thrush, but it also can be used intestinally or the genitals as well. Also, you tend to see its association with dental components. So mycosis, secondary mycotic infections of the skin, the mucous membranes, thrush, cradle cap, respiratory tract, bacterial, viral conditions, tonsillitis, cystitis, otitis, acne, dental granulomas, adenitis. So it's got a variety of things, but it doesn't tend to be more those systemic typical candida type symptoms. Those more systemic typical candida type symptoms tend to be Pleoalb is where that functions. And again, the dose depends on product form as we reviewed in that last chart. Okay, so those are the two main Candida remedies, plus for the Pleo-Cand for the cell wall deficient forms, if there's been a lot of Candida, history of Candida and history of medications trying to reduce it. While I'm just mentioning Pleo-Cand, I did get a question, and the question was about testing for the presence of cell wall deficient forms. Specifically, in some cases, in laboratories, they're able to culture for the different types of species. And but on the flip side, if they're only in cell wall deficient form, then it actually may be hard to. So there isn't a specific test that can be used to be able to check for cell wall deficient forms that I'm aware of. You can, with the remedies, do some muscle testing or do some EAV testing, and then that with different ampules, and that may give an indication of the types of cell wall deficient forms active in the body. There's lots of really good information. We have lots of good information on the Sanakeels, and that would give more information about at least 13 cell wall deficient form components. And there's one more question here. With the SIPs, they are available specifically with PEF and ALB. So with those two specific remedies, the ampules are available. Okay, so I want to quickly talk about alkalizers. And so if alkalizing and pH balance is a new concept for you, then I encourage you to listen to a past webinar that will be under the education system section on the website as an archived webinar about the art of alkalizing, and that will give you lots of really great information about alkalizing in general. I want to talk a little bit about these guys, and what I'm going to be talking about specifically is Basic Tab. Basic Tab is one of the alkalizers that we've had in Canada and at Biomed for over a decade, and we have just recently introduced this into the United States as Terra Medica as well. And so for those of you that are familiar with Alcala, it is Pleo Alcala. It's a powder form working as an alkalizer to essentially help to rebalance acid-base balance in the body. Because it's a powder, it has to be drank, and always done with warm water on an empty stomach. There is, however, if you've tried it, you know that it also is very salty and not always the best patient compliance. And so here we go. We now have a solution to that, Basic Tab. The formula is a little bit different than Alcala. It includes potassium bicarb, sodium bicarb, which are the two key components for an alkalizer, and then also calcium carbonate and magnesium carbonate. And so you've got the four minerals that are used for acid-base balance within the body in this formula. Because it's in a capsule form or a tablet form, it dissolves within the stomach within 1 minute. It's very easy to take. It's still important to make sure that it's taken on an empty stomach with warm water, so therefore it doesn't interfere with the stomach, but gets pretty much right into the small intestine, so it can start to do what it needs to do to start alkalizing the body. And this is the one that I specifically take myself when I need to. I usually, at this point, I am a vegetarian, but I tend usually once a year or sometimes twice a year do a bit of an alkalizing tune-up, and so I really like using this one. And this is the one that I generally recommend to all my patients when I'm doing acid-base balance with them, which is with most of my patients. And again, it's one that's really easy to use. Okay, so we talked about Alcala a little bit, and so now probiotic 7-in-1. And why am I talking about probiotics? Again, because we talked about the flora in the body and how important it is to help keep Candida under wraps. And so probiotic 7-in-1, it's 7 unique strains of different forms of probiotics to colonize from the small intestine into the large intestine. This is the formula, so there's lactobacilli, there's bifidum bacterium, there's a streptococcus, and we have a paper on it, and it explains why these different strains are within this formula. So then that way, if you want to learn a little bit more about 7-in-1, then the information is there. 1 to 2 capsules twice a day is what is recommended. And the nice thing with these probiotics is the way that they're manufactured. They are acid stable and they're also shelf stable. And so what shelf stable means is they don't actually have to be kept in the refrigerator. So for patients that have a hard time remembering to take it if it's out of sight, or if patients are traveling, or if you're traveling, then this is a really nice formula to be able to have on hand. This formula, again, has been in Canada for over a decade, probably closer to 2 decades, and it's our #1 selling product in our Biomed line. We have now just introduced it down to Terra Medica, so this is a product for those of you listening from the U.S. You're able to now be able to get this through Terra Medica. I want to talk about one more probiotic quickly, so Lactobacillus sporogenus. This is a single species probiotic, and in addition to helping replenish intestinal flora, it's very useful in cases of diarrhea or taken after use of antibiotics. This is also a very, because it's an right-spitting lactic acid species, it has a very alkaline component naturally within it. So there's lots of practitioners I know that use Lactobacillus sporogenus as an alkaline component in healthcare. So it kind of serves a few purposes there. Okay, so after talking about those, one of the reasons I'm talking about them, in addition to the fact that we're talking about the gut and Candida and flora, is that we've now put this kit together. It's a brand new kit called Candida Fix, and it's been put together so it's easy for patients to take, everything that they need. So for the pH balance aspect, the probiotic intestinal flora aspect, and the pleo-alb to reduce the Candida fungal overgrowth is all in one. So it's a very effective biological approach for the elimination of Candida and fungal overgrowth. And one of the beauties with this is it's not hard to do. I know if you've been working with Candida and Candida cleanses and Candida diets, you'll know that it's very intense. It takes a lot of dedication. Sometimes, and in many cases, doesn't always work, or things rebound after some time. So this is a very, very different approach. And this is the thing that I need to really emphasize. This is coming from a biological approach for supporting the body's natural regulation components and supporting from a microbial perspective. And so therefore, by changing us back, going from that swampy pond back into the nice pristine pond, this will help the body, the immune system, the flora that naturally exists to keep the Candida back under wraps. And so this kit is going to be able to help your patients do that in a very quick manner. This is a 4-week program, so the products, there's enough in there for 4 weeks or 1 month. In some cases, it is recommended that the patient does 2 of these kits. It may take that much time in order to get things rebalanced. With all the diet that we talked about, the regeneration and restoration diet, this is also recommended. And partially it's recommended because it's recommended in general to kind of regenerate and reestablish within the body, but then all the principles in there of what to eat is also very good at supporting the terrain in order just to get proper acid-base balance, support the mucous membrane, support the flora, and that type of thing. And so I just wanted to talk, let me just go back here. Okay, so it contains the pleo-alb drops to reduce Candida overgrowth, probiotic 7-in-1 to replenish the healthy intestinal flora, and then finally basic tabs to rebalance normal acid-base balance levels. And so through this, optimize the intestinal conditions and support self-regulation within the body. The 3 pillars for addressing and eliminating Candida or fungal overgrowth from a biological medicine perspective are this reducing Candida, replenishing intestinal flora, rebalancing acid-base balance. And so this kit does all of those things in a very easy kind of way. By doing these things, it leads to a healthy digestive system, balanced intestinal flora, and a strong immune system. And these, as I said at the very beginning, are the keys to naturally keeping candida and fungal levels in check throughout the body and helping to reverse overgrowth and get things back into their normal ratio. So with the Candida kit, or the Candida Fix kit, we also have patient handouts, and so within the kit, everything is described. Tonight, with everything I've talked about, the kit talks about it in that kind of way so that patients understand that it's coming from a different approach. And then also we have these handouts that you can request through an order, and these handouts you can be giving out to patients so that they have a bit more education about what a natural biological medicine approach is. Okay, so about mercury. We have a practitioner here that posted a really great dentist in the Santa Cruz, California area named David Biles. And there is a link here. And this is a link we also have on our Terra Medica and Biomed website. And I'm just going to make a copy here so that it's into the participants so you can see it in the chat room. And it's about a biological dentistry, a critical inventory. So basically this article then talks more about what biological dentistry does, but specifically about mercury or amalgam removal. It's one of those things that you don't want to have done haphazardly. There is a lot of things that need to be taken into consideration when moving mercury, protective mechanisms for the patient and also for the dentist. There's a lot of ventilation that has to happen, and then there's detoxing remedies that can be given before and after, and chelalators and chlorella and those types of things. So, but with that said, and because we've talked about Candida and its association with heavy metals, specifically mercury, if you've got patients that have amalgams, and because there is positive links between Candida overgrowth and amalgams in the mouth, it may be something to be recommending to patients if you know a good biological dentist in your area to be able to go through and have the amalgams removed and replaced with more biocompatible materials. Okay, so I have posted that link in the chat area for those of you. Okay, and let's see here. So recommendation for duration of using the Pleo remedies for chronic or systemic Candida. The general recommendation is anywhere between 1 and 3 months. And so if you're dealing with somebody who has, it's a chronic condition, then 3 months may be the way to go. Partially with a 3-month marker, it takes the average patient up to 3 months for pH balance to come back into pH regulation and balance to come back into balance. And so in some of those cases in that 3 months, by reducing the Candida with the pH balance, with replacing and replenishing the microorganisms, the flora and the fauna, and also just getting the gut healed, it can take up to 3 months to do that. So for patients that maybe are not as chronic or not as systemic, then 1 month might be sufficient. It's one of those cases, the Candida Fix kit has been designed for 4 weeks or for 1 month. And so for some patients, that 4-week program might be sufficient. However, for some patients, they may need to do 2 kits or 3 kits, depending on symptomatically, as you're watching progress, what they need to do. Okay, and then we have another question here. If a patient comes in with a urinary alkaline state, would you still have them continue with the basic tabs? The answer is maybe. It depends on what is going on. So if you initially have a patient come in and you're doing urinary pH testing, and you notice that first thing in the morning, let's say they do, so first thing in the morning urine is supposed to be naturally more acidic. However, there's still a range. If the pH tends to be lower than 6.2, so 5 point something to 6.2, then that's still indicating tissue acidosis because that's more acidic than the range of 6.2 to 6.5 or 6.8, which is the first morning urine. Any urines that are coming in for the rest of the day should be somewhere between 6.8 and 7.4. That can change depending on what's being eaten within the day, however. And so if you've got a patient that is coming in and having a very alkaline state, but they have a chronic degenerative condition, and they're not a vegetarian, they're not a vegan, you may want to start thinking about other things. And so other things could be, they could be on a medication that causes an alkaline urine. They may, bacterial infections, bladder infections can cause an alkaline urine. And also if there's what's called an acid block, or the kidney tissues are acidic in such a way that they're not releasing the acid any longer, then that also can indicate an alkaline state. So there's a few parameters to be thinking about if you're seeing a very alkaline urine in a patient who hasn't necessarily done anything to create an alkaline urine. And if it's for one of those scenarios, then yes, you would still have them take the basic tabs because they still fundamentally are acidic. This may be something where if you have the ability to look at the blood or the saliva and look at the pH on those levels, it might give you a more accurate picture for that type of patient as well. Okay, so I hope that answers that question for you. Oh, there's one other thing you can do if you have a patient that is presenting with very alkaline urine, is you can switch off of basic tabs and go on to citrocil or pleocitro and pleosanovis. And what that will do, the citro specifically, will help support the kidney tissues at starting to being able to flush the acid out. And then within 2 weeks, generally with that, you'll find that all of a sudden the urine becomes very acidic. So now you know the body's actually properly excreting the acid out of the body. The last point I want to make is while somebody is alkalizing, their urine during that time is going to actually be very alkaline. And so that's one thing to remember. When you're alkalizing, you're putting somebody into a false alkaline state in order to use up all the excess hydrogen ions, which is creating the acidity. So therefore, while alkalizing, expect a very alkaline urine. Okay, next question. Should we take probiotics before meals or with meals? This is a good question, and it's up. There's a lot of debate and questions about that. So if you think about probiotics from a food sense, when you're eating things like sauerkraut or kimchi or any fermented type foods, the probiotic is going to already be within there. So if you're eating it, then it's still going to end up populating the gut. And with these probiotics, the probiotic 7-in-1, they are acid and heat stable. So it does mean that if you are taking these probiotics with food, they are going to survive through the stomach and be able to get into the intestine and the distal portion of the small intestine and the colon to populate. So with probiotics 7-in-1 specifically, they can be done either point, whether they're taken with food or away from food. They're still going to be just as effective. Okay. A question regarding the SIPs, which in Europe are used as injectables to get rid of Candida. It would be more about using them in a general protocol to be addressing systemic Candida and helping to downregulate the Candida into the more physiological form and in the very low part of the population. And so whether you're using the SIP as an injectable or you're using the drops, you're still getting the remedy systemically into the body to be able to deal with the systemic Candida. And the Candida Fix Kit, it is available. We're launching it in Canada, but it also is available to practitioners in the U.S. For practitioners who would be ordering it from Terramedica or from the U.S., we would be shipping it from Canada. However, with that said, it's something that we will be introducing into the U.S. shortly. And the Pleo San Cand remedy and the Pleo Alb remedy, I don't know if they're stocked in the US, but I do know that if you order them that you can definitely get them, and they would be shipped from Canada. Okay. So generally from a die-off perspective, using this kit or this type of program, you don't tend to get the same type of die-off reaction when working with it, partially because, again, what it's doing with the Pleo-Alb remedy, it's working at, number one, populating the gut with the physiological form in a very healthy state. Number two, what the remedy is doing is it's helping downregulate the Candida albicans from the pathogenic or more virulent state into the physiological state. Number three, what it's doing is it's getting, when it downregulates, it becomes less embedded in the body and in the tissues, and it allows the immune system and the immune defenses like the phagocytosis to actually occur, and therefore allows the immune system to rid the Candida as well. So in this respect, and often generally just when you're working with isopathic remedies, you don't tend to get the same kind of die-off reaction. What you may get though, and this is one thing to be keeping in mind, is if you're downregulating Candida, you may get some mercury or heavy metals in the gut circulating more, and so there may be what is seen as a healing crisis in that respect. And so again, something as simple as something just to bind the mercury up, chlorella. From Biomed, we have a product called Biorella, which is chlorella tablets. That can be taken during this whole process, and that is a binder of heavy metals, specifically mercury, and then that would help address any healing crisis from that respect. As far as the nutritional component or the diet, there's no die-off reactions that occur with that. And because you're dealing with probiotics and basic tabs and changing the milieu and terrain, again, it's not one of the things you're going to be seeing as a die-off as you may see in those more typical type Candida cleanse, other types of diets using other kinds of remedies. Okay, and that looks like that's the end of the questions. Thank you for joining tonight's webinar on the Candida and fungal overgrowth, rebalance using an effective biological approach. I truly, as you can tell, love this approach to medicine and this approach to our patients. And I know that this is a very effective approach. It's been around for decades. Some of the best and most renowned biological medicine practitioners that I've known in Canada and the United States and also Switzerland and Europe, this is the approach they take, and they get very, very good results that are long-lasting, that are very effective, and are supporting the body's natural regulation. And so I strongly encourage you to think about this approach and thinking about this approach to your patient care. We've put together the Candida Fix Kit, and so trying to make things easy for you, for your patients, and having everything together so that